And in Texas, a healthcare worker has tested positive for that disease.
Officials say that female nurse who cared for Thomas Duncan at a Dallas hospital before his death last week from the virus, she has tested positive for the disease. The CDC is working to confirm that it's the first case of Ebola to be contracted in the United States. Dr. Tom Frieden of the Centers for Disease Control and Prevention said the nurse's infection could have resulted from touching contaminated protective gear.
The care of Ebola can be done safely, but it's hard to do it safely. It requires meticulous and scrupulous attention to infection control.
Officials in Dallas say despite the apparent infection, healthcare workers are safe. And this newest case raises questions about the effectiveness of the protective gear healthcare workers wear when they're treating patients.
KRDO News Channel 13's Eric Fink talked with our medical expert to get his thoughts. See you at 5.
One doctor in southern Colorado believes it's possible the latest Ebola victim was taking off protective gear at the time of infection.
The problem is when you use those, you have to take them off in a very deliberate fashion. You have to take them off in reverse order. Somebody helps you take them off. You wash constantly while you're taking them off so nothing gets transmitted.
Dr. John Torres says there are clear, complex steps to follow when putting on and taking off the gear. And one misstep could be dangerous to one's health.
If this person is, takes the gloves off and hasn't washed her hands and still hasn't taken the gown off, rubs her nose, rubs her eye, anything like that, it can get transmitted that way. If their gloves are off and they're taking their gown off and they peel it back and the outside of the gown touches the skin, it can get on the skin that way.
Doctors and nurses treating the disease in the U.S. use enough protection from bodily fluids, not full hazmat suits.
It's obviously not being protective enough in certain instances, and so I think, again, we need to look at what they're wearing in Africa, maybe the full body protection.
Torres stresses the transmission of Ebola is not airborne, and the risk of the disease spreading to Colorado is extremely low. Eric Fink, KRDO, News Channel 13.
And the latest Ebola victim's identity has not been released yet.
CDC Director Thomas Frieden says we could see more cases in the coming days as everyone who treated Duncan is now considered to be potentially exposed.